Many of you have been asking me to make a video regarding the root causes of GERD, aka reflux or heartburn. So finally, here is the video. So in this video, I will be talking about primary and secondary root causes of heartburn and reflux so that hopefully you don't have to stay on those horrendous antacids, proton pump inhibitors, famotidine. You really don't want to be on that long term, so listen up. Okay, first, we're going to talk about some primary causes, and then we're going to talk about secondary causes that might be contributing to those primary causes, if that makes sense. So, the first primary root cause is a relaxed or weakened lower esophageal sphincter. That's one of the primary causes. A secondary cause would be what causes that relaxed or weakened lower esophageal sphincter. Let's just call it the LES for short. So anything that causes increase in pressure in the abdomen is going to weaken that LES. Think about it. You want that sphincter to be nice and closed so that food is not coming up into the esophagus. And if that's not shutting properly because it's weakened, then that's when you're going to start to see some of that reflux coming up into the esophagus. So some things that cause increased pressure, well, we know that being overweight, pregnancy, all of that can definitely increase the pressure there. If you have a lot of bloating for any reason, if you have SIBO, again, that can cause the increased pressure there. If you have some kind of hernia, hiatal hernia can definitely lead to that weakened LES. Nicotine and medications can directly lead to the relaxation of the LES. Progestin containing birth controls, benzodiazepines, calcium channel blockers, or some blood pressure medications like amlodipine. Frequent NSAID use like ibuprofen, naproxen, and albuterol as well, taken for asthma. Nitroglycerin, nitrates can reduce the LES. Overeating can also lead to that distension. Certain connective tissue disorders like EDS. Certain foods can temporarily decrease LES functions. Common triggers you think of for reflux, right? Like caffeine, alcohol, chocolate, peppermint, and high fatty foods. And then as we age, gradually that will decrease the tone of that LES sphincter. Not much you can do about that. But as you can see, you have a lot of control over many of the other root causes that I mentioned. So having a healthy diet, maintaining a healthy weight, getting rid of any SIBO or dysbiosis, trying to avoid those medications and maybe looking for alternatives, not overeating, and definitely not laying down right after a meal. So these are some of the primary and secondary root causes of acid reflux. Let me know if you want me to make a part 2.